Well, for those of us who've had children, wouldn't it have been nice if those little ones came with a user's manual? Yeah, the truth is many parents are doing the best they can and making decisions they hope will benefit their kids in the future. But one of those decisions that has become a topic of great debate is co-sleeping with the kids. Marianne Harvey is a registered nurse at PRMC, and we're going to talk a little bit about it this afternoon. Thank you for being here.
Thanks for having me.
For those who aren't familiar, explain the idea behind co-sleeping.
Co-sleeping is when parents sleep within close proximity to their baby or their infant or child. Whether that means bed sharing or room sharing, it's just dependent upon those two different types.
Yeah, and just like anything when it comes to parenting, there are some concerns, particularly unsafe sleeping environments.
Which is one of the biggest things that we are trying to look into. One of the things that we found is that SIDS, although the risk has decreased or the numbers have decreased, we are seeing a steady state of them right now, especially down here on the shore. It seems to be something that we're seeing a little bit more of. So the American Academy of Pediatrics recommends that parents room share over bed share, and room sharing just means having a crib, pack and play, or bassinet in the same room, and the American Academy of Pediatrics says actually that they would like that to happen up until the children are about a year of age. So it's one of those things that we do really want to tell parents is room sharing is there's more benefits to that than there are to bed sharing. Bed sharing has a lot more concerns for suffocation risks when you sleep with your baby in the bed with you. You tend to have a little bit more sleep deprivation going on, especially in their first few months. So especially for children under 3 months of age, having their own sleep environment is really much safer than sharing a bed with a parent who has a risk of potentially rolling over or falling asleep with that baby real close, and you don't realize what happens when you sleep, and sometimes the babies just can't get out from underneath. Having them in the same room is much better than having them in the same bed.
Okay, so for those who are for co-sleeping, there are some benefits, right?
What the proponents are saying is that bed sharing can improve breastfeeding, it can improve sleep habits, and the bonding. But the benefits, the risks actually far outweigh the benefits that some parents may see with bed sharing. So if you do feel, sometimes what I'll tell parents is if you feel like you need them right there close, there are bassinets and such that almost attach to your bed, but it provides the baby with their own surface, because it's really important to remember the ABCs of safe sleep when we have our babies alone, which means that they're in their own sleep environment, free of any pillows, blankets, or soft toys, and then on their back, and then in a crib with a nice firm surface. A lot of times our beds are more soft because we like that softness, and babies benefit more from a firm surface rather than something soft. So babies really need to have their own crib, bassinet, or play area, playpen.
Now you had said that co-sleeping in the same room is good up to about the year 1 years old, right?
Yes, the American Academy of Pediatrics recommends that parents have their children in the same room until they're about a year old. So that means usually by the time they get out of the bassinet, they're usually in a crib or a pack and play. If parents decide to move their children out sooner into their own room, the American Academy of Pediatrics really suggests about 6 months they should start maybe transitioning.
So the toddlers should be in their own room as well?
It should be. Yes, it's a lot harder to get a child who is used to sleeping with their parent out of their parents' bed. So if you do have a toddler that finds themselves in bed with you, they do tend to, it takes a little bit more patience and trial and error to get them into their own room and to sleep on their own. So the patience with that is a little bit more.
Okay, so let's switch gears a little bit. What do you say to wearing Baby wearing, which is another hot topic, I guess.
As baby wearing is something that we've seen a lot more frequently over the last few years, and it's very beneficial. Baby wearing is just basically where parents have a front pouch or a wrap or a sling that they put baby right in and wear them around during activities, or going grocery shopping, or even just doing household chores. The benefits of baby wearing are pretty well established now. We really do see that it helps to keep babies calm. It helps during that normal newborn crying period to help comfort them and to keep them, especially when they get a little bit more fussy. During this time of year, it's also beneficial if you baby wear, especially grocery shopping or at the mall, when others tend to come up and want to touch your baby. They're seeing that people are a lot less likely to come up and look at it or touch a baby that's right up against mom's chest or dad's chest. So it may actually prevent against some of the flu, RSV, and some of these illnesses that we're seeing. So baby wearing definitely has a lot of really good benefits, and it's good to do.
All right. Good information. Registered nurse Mary Ann Harvey with Peninsula Regional Medical Center. Thank you so much.
Thank you.